Welcome to Good Life. I'm Dean Wilson. So glad you've joined us. We're appreciative of all of you, and we thank you, those of you who have found us on social media, and those of you that have visited our website from all over the world, 64 countries or so, and we are grateful. You can always find us at goodlifetelevision.org, and it's just been a great, amazing run of guests we've had from all walks of life, all ages, all careers. We've had a little bit of everything. So you can find all those at goodlifetelevision.org. I'm really excited about my guest today, County Supervisor here in Santa Barbara, California, where we're sitting. He's the chair of the County Supervisors, actually, in addition to being the supervisor for the 2nd District. Gregg Hart is with me. Gregg, welcome.
Dean, thank you so much for having me today. It's really an honor to be with you. And I'm such a fan of the Turner Foundation and all the fabulous work that you're doing for our community and everywhere. Really a pleasure to be with you today.
Thank you so much. We appreciate that. And I was just reading about you. It's interesting that you really are a Santa Barbara guy. You grew up here in local schools, City College, UCSB. You've kind of have hit all the Santa Barbara spots. Talk about kind of your love for this district and what it was like to grow up here and that sort of thing.
Well, I'm really lucky. I'm actually adopted by my parents, and they brought me into an incredibly loving home and took really good care of me and moved to Santa Barbara when I was really young. I moved to Lompoc when I was 2, and then the city of Santa Barbara when I was 5. And, I'll always be grateful to my parents for making those career choices to bring me here. And as you described, I grew up here in Santa Barbara. My father was the library director for the city and county of Santa Barbara, and my mom was an elementary school teacher. So books and learning and education were a really key part of my upbringing. And my father instilled a love of literature and books, and I continue that through my whole life. I'm a lifelong learner, and really Santa Barbara is the perfect place to live. We have the UCSB and Santa Barbara City College in Westmont. There's this tremendous confluence of intellect and creativity and art and science. And it's really an incredible community. I'm very fortunate to live here and to have had the opportunity to serve on the Santa Barbara City Council and now on the County Board of Supervisors. And with the exception of the time that I've lived in Isla Vista when I was going to UCSB, I've lived since I was 5 years old in the 2nd District in Santa Barbara County. So to have the opportunity to represent my neighbors on the board is really a unique privilege.
That's amazing. Yeah, I was going to say public service has really been kind of part. Your mom, I know, was an elementary school teacher, and you really have been, in kind of, I don't know, ingrained, but it's been a part of your family life. It seems like. What for those that don't know, and I know a little, but what are the typical challenges that a county supervisor? How do you, recently I know it's probably all COVID all the time, but in a normal year, and we'll talk about COVID in a second, but in a kind of, what is the portfolio, the purview of a county supervisor typically?
Well, it is really broad, and the county is a very large organization. We're a subset of the state government. The state of California passes laws and tries to implement programs, and counties are the vehicle for bringing that state legislation and those state programs directly to local residents. So we are responsible for the criminal justice system, for social services, for the agricultural policy, everything that you could imagine that local governments do, the county has its hand on. And in addition to that, of course, we have all of the local planning responsibilities. So subdivisions and permits and all of the planning effort that goes to keep Santa Barbara County a beautiful place to live, work, and recreate. And so it's a really big job. The county budget is over $1 billion. We have more than 4,000 employees with the largest employer in Santa Barbara County. And it's a job with massive responsibility. But as you described, I've made a career and a life out of public service. So I bring a lot of experience to this job. And as you said, it is COVID all the time right now. And that experience, that I had as a planning commissioner in the city of Santa Barbara, city council member, and Governor Davis appointed me to the California Coastal Commission. I used every bit of that experience in this past year as we've tried to do the best we can with the COVID-19 pandemic.
I bet. And that's my next question is about COVID. But I will say this about planning. People hear, permits and planning commission, maybe they kind of cringe a little. I'll tell you, I think there can be that thought process until you've been somewhere where they don't have planning commissions. Until you've been, and if you've been to places or, wherever it might be that doesn't have that, and you see the results, you understand why we have planning commissions and why that's thought through. So it's actually, I'm a fan. I mean,
that's a great observation. And Santa Barbara County is not an accident. The beauty and the majesty of this community is a product of generations of people who worked really hard through collaborative planning processes and just a vision to protect the natural beauty and have a built environment that's inspiring and is something special in itself. So we're very careful about what we approve and how we go through that process, and the result speaks for itself. There's sort of a synergy that comes from being a place where people want to travel and visit and ultimately live that attracts businesses and really creative entrepreneurs and successful people from all over the planet.
Yeah. It does seem like everybody wants to come here. I mean, to visit at least. Let's talk about COVID-19 for a moment. And it was about this time last year, I guess, when, it landed on our shores. And I'd just love to have your perspective on kind of, where we've been, where we are, and where we're going. Kind of take it from there in terms of COVID-19.
Well, I know that this has touched everyone in really profound ways. And as 2020 will be a year that we will never forget as long as we live, to whatever age you are. My mother is going to be 90 years old in the middle of March. And last year, we had to cancel her birthday because it was right on the verge of the state shutdown. And I knew that was going to occur and didn't want to put her at risk. And I, at the time, never really imagined that her 90th birthday, a year away, would potentially be in jeopardy too, for the same reason. So this has been difficult. People have lost their livelihoods, their lives. Loved ones have been hurt financially and physically and emotionally. So we're all doing the best we can and trying to be resilient and weather this storm and get to the other side. I think that we're going to learn a lot of lessons, in hindsight. But I know, having sat where I have been as chair of the Board of Supervisors, that we've had to make very difficult decisions in real time without sufficient information. And I think, ultimately, folks are going to look back and say, might have done this better and that differently. But I can tell you, everyone has been committed all along to protecting lives and trying to hang on to as much of the economy as we can and trying to be flexible and adaptable and resilient. And it really has been an incredible inspiration to me to see how all the community organizations have pivoted, like the Turner Foundation and the Food Bank. And I could go on and list 50 different organizations that have kind of reinvented the way that they do business to accommodate this moment, keep people safe, and keep kids learning as best we can, and keep businesses alive. And those things are all intention, and it's not been easy. But I know our community takes this very seriously and has dug in hard, and we're doing the best we possibly can.
Yeah, well, and thank you for what you have done. And it's not going unnoticed, and it is unprecedented. I mean, I don't. None of you were on the County Board of Supervisors in 1917, so we haven't seen something like this before.
I can remember distinctly early on in the pandemic when the public health folks came to the Board of Supervisors and they were looking ahead and they said, this could get really serious in the summer, in the fall. There could be multiple surges of the virus. And I thought at the time, wow, that's just unimaginable. isn't the shutdown that we're going to do here in March and April going to really get this under control? And as it turns out, it's very difficult to get it and keep it under control. We were successful early on in the state of California with the shutdown order to keep things tamped down. But since the virus is invisible and asymptomatic people can spread it, it's been very hard to keep that sustained. And here we are, really in the middle of the worst surge of the entire pandemic. And I can't help but reflect and looking back on the charts that showed how the virus spread and the surges that they had back 100 years ago in 1917. And the pattern almost perfectly matches what we've experienced so far. So
Really?
these things are extraordinarily difficult to manage because they require almost unanimous consent and support for the interventions. And as a country, we struggled a little bit logically about wearing masks. It shouldn't be a political issue. It shouldn't be, a question mark. It should just be the reflexive response to do the right thing. And what most people are, not everybody. That's going to challenge all.
Yeah, I'm amazed when I think about it that we're trying to get an entire country to do all these things, trying to get an entire country of 340 million people to stay 6 feet apart from each other, trying to, it's just, this is a massive undertaking. It's mind-boggling.
I was talking with somebody who had lived, through the Depression and World War II and things that, are enormously difficult. And I kind of thought to myself, well, those things seem more difficult than this. But she said, no, that this is much, much harder because in those situations, you had camaraderie, you had togetherness, you had a way, to emotionally connect with people. And that this situation is so much more difficult because what we're asking for people is to stay apart and to avoid that contact. And so she said, one of the hardest things is when she gets sad, she can't even get a hug from her friends and relatives. And that, I think, sums it up so well that that's what this challenge is it's extraordinary. And we're doing really well considering how difficult this situation is.
Yeah. Yeah, it has been, and I think one of the hard parts has been because we thought when we were in April and May that when we got here we would be moving out of the woods, and then it was it's kind of felt a little like it keeps kind of getting pushed, and nobody's fault. But it has been, and I think that's taken a toll. Can you talk at all, and if you can, it's okay, but if possible, about the vaccines, in terms of what people can expect, how this is working, who do they talk to? Just kind of, if you could give a little bit of insight on that, it'd be wonderful.
Yes, this is really an intense moment because I think there is hope finally now with the introduction of the vaccine and the availability of that. We can see light at the end of the tunnel. Before, as you described, we had these subsequent waves where it was really trying to get a handle on a surge and keep the hospital capacity intact so that we could protect patients that needed that intensive medical care. But now we have the hope that with the vaccine, as effective as the ones that have been developed, that if we can get enough people vaccinated, we can really end this and get to a point where we can go back to a normal life. But this transition moment is probably the hardest moment because the vaccines aren't available in the quantities that we need to vaccinate everybody as fast as they'd like. And so we're having this very difficult rationing process happen where we can't physically get enough vaccines in our county to give it to the people that need it the most. Obviously people who are older have the greatest risk from contracting the virus in terms of their health outcomes. So we want to make sure they can get the virus ahead of younger people. In addition to that, folks who are on the front lines in providing medical care, who are treating COVID-19 patients, have tremendous risks. So we need to inoculate them as well. And we just don't honestly have enough vaccines yet to accomplish both of those goals. There's about 30,000 frontline medical staff and first responders in Santa Barbara County. And there's another 30,000 people who are over the age of 75. We've only gotten about 40 or 50,000 vaccines in hand yet. So we can't even inoculate all of those people yet. And folks who are 65 to 75 are another 70,000 people. So we can't get to all the people that are the highest priority. And it's going to take some time for the manufacturers to produce enough vaccine to accomplish that. And this is where it's really difficult for people, because the system isn't set up to assure everybody a place in line, because we don't know how many vaccines are coming with each subsequent delivery. It's a black box at this point. I'm hopeful and confident that the new administration in Washington is going to get a handle on that and be able to provide greater transparency to the state and local governments about the delivery schedules. But right now, we don't know. We're just waiting to hear. And as soon as we get vaccines into our county, we're reaching out to schedule appointments and get those shots in arms as fast as we possibly can.
And when you say that you got 50,000 of the vaccine, is this Pfizer or Moderna?
It's a combination of both. So there's different delivery.
And is that one dose? I mean, I know with the Pfizer, I think you have to have 2 shots. Are you talking about total 50,000?
Yes, that's exactly right. So you have to subtract the second vaccine.
Right.
Inoculation from that total. So, but we're not doing it that way. We're doing, first in, first out. So if we get a vaccine, we either are giving it to somebody for the first time, or we're giving it to somebody as their second dose when it's needed. We're not holding back vaccine to give the second dose to people. We're counting on the fact that the new supplies will arrive in time to give the second shot to the person who needs that second shot. So we're trying to get as many people vaccinated as fast as possible.
Yeah. So how long does the shipment come in?
It's been coming about once a week, but it's been wildly different in quantity. The initial deliveries were large, and the subsequent deliveries have not been as large. We're hoping that that's a supply chain bottleneck issue, and that as the manufacturers are able to ramp up their production, that the deliveries will be larger. But they're working as fast as possible in the manufacturing end of the system, and the distribution to state and local governments is relatively quick too, but it's just physically limited by the fact that this is a new vaccine, and they're ramping up production and trying to get as much out as they possibly can, but it's not enough. We can't. There are 450,000 people in Santa Barbara County, and we want to inoculate every one of them. And as you can see, we haven't even received 10% of what we need yet.
Right. So let me just restate what I think I heard, just for clarity purposes. So you're saying, there's been 50,000 have come in. There's 30,000 frontline health workers, which I think everyone who would agree need to be the priority. There's 30,000 75 and over. There's another 70,000 of 65 to 75. Is that correct?
Exactly right. Yes.
So then where does it go from there? Does it just go down by age from there?
The governor has changed the original allocation formula. There was a very complex system that was initially established that was going to do essential workers as they were defined by the state of California, and then was going to work through the age categories. But now the system has been shifted to focus on age. And so what I think you're going to see is the 75 and up, and then moving down to the 65 and up. But there are also concerns that are valid and legitimate that don't have a good answer about what about folks who have that are more vulnerable at a younger age. Somebody that has a pre-existing medical condition, perhaps particularly with their lungs. How is that person going to be accommodated in this system? And at this point, we don't know the answers to those questions. The state of California is making those determinations in its consultation with the Centers for Disease Control at the federal level. And then we're reacting to that new direction from the state of California. And it's happening very quickly and changing very quickly. Last night, I learned through the news that the governor was proposing to change the distribution system to use the large health insurance operations, Kaiser Permanente and Blue Shield, as direct recipients of the vaccination, that they would then be responsible for just distributing in communities. So it is a very dynamic situation, and I can't even predict where we're going to end up.
Wow. So this is, has this just been your life for the last 10 months? I mean, you guys must be just having the volume of details and logistical planning must just be overwhelming.
It's astounding, and you're exactly right. It's been 24/7, no vacations, no breaks, just nonstop. And the folks in public health are working 16-hour days. There just aren't enough people, and there's not enough time to do everything that needs to be done. And people have questions all the time, and are legitimately and understandably really concerned. And this is their personal health, the concerns of their loved ones. They want answers to questions that we haven't often had the best answers for. We're doing it as we can, as fast as we can at every level, from testing to contact tracing to now the vaccination process. And there is no playbook. Nobody set up this is how you do this 100 years ago. And it's been
right.
Since. We're all doing it on the fly. And that's, again, I am more inspired by the ability of the community to flex and to adapt and to be resilient to this moment and fill in the gaps. Government can't do nearly enough to solve all these problems. So we rely on the partnerships we have with the nonprofit community, private businesses, churches, fraternal organizations. Everybody's pitching in and helping people who need help. And when this is all said and done, I think we're all going to be proud of the response that we did as a community and as a country to really challenging time.
Yeah, we should have a parade or something. I don't know. We have a lot of parades around here.
That would be nice.
Yeah, we should. Yeah, and you guys should be on a float, I think, with all the nurses and doctors. And good grief. Last question on COVID, and we only have a few minutes left. But should people, in terms of questions about the vaccine, should they just go to their doctor, or is there a number? If they say, "Where am I in line?" or "How do I get in line?" or "I should be in line," or whatever their thing might be.
I think folks should probably do all of the above, because it is changing so quickly. New opportunities to get vaccinated can appear because the structure is changing. So yes, number one, I would talk directly to your medical provider. They may very well be now part of the distribution system. In addition to that, publichealthsbc.org has a really good website that has lots of information. There are frequently asked questions. There's a wealth and a very deep source of information at the publichealthsbc.org. That's the Public Health Santa Barbara County. That's what those initials are for, .org. But that's a great resource. And if you don't have access to a computer, you can call just the 211 information line, and you'll get a live person who can answer your questions and direct you to the best resources that you're looking for.
That's wonderful. So publichealthsbc.org, or call 211 for information. This
Exactly.
is a resilient community, isn't it? I mean,
it really is. And
I was floods and the fires.
For the COVID pandemic, at the breadth and depth of all the nonprofits that serve people. And this moment, people have just reinvented their mission to accomplish goals and objectives that are needed now and to get people help. The Food Bank of Santa Barbara County is a great example. They are doing 10 times what they did last year on the fly because the need is there. And, people are donating and helping financially and assisting them, in unique ways. There are partnerships that didn't exist. And that's just one example. I could go through every service that anybody could imagine needing, and there's a story to tell just like that.
Beautiful. Well, I really appreciate you coming on. I think the parade's a good idea. I think we should stick with that.
I know we all want something normal, and
we
looking
need something.
Forward to something like that is a really good idea because things are probably going to get a little harder or stay hard for a while before they get demonstrably better. And everybody there is no answer other than to be patient and to be kind to others, take care of yourself, take care of your physical health, make sure you get exercise, and take the stress down out of your life. Don't watch the news every minute. And if you are getting your news, be super careful about information coming from social media. That is not a good source of information. I really encourage people to go directly to the publichealthsbc.org website, because that's part of the anxiety I think people are feeling, is that they're getting these crazy messages from social media that aren't true, and they create anxiety and stress and worry. And we want people to know the truth and to be able to act on good information, and going straight to the source is the best way to do that.
Yeah. There's no way out but through, as they say.
That's right.
Supervisor Hart, thank you for your time. Thank you for your service, and we're rooting for you, and we're looking forward to getting to the other side.
Well, Dean, thank you so much. And again, thanks to the Turner Foundation for all the wonderful work you do in our community. You're one of the examples that I would cite about pivoting and providing services to your clients in new ways that really makes a difference in their lives. And I'm just so proud of all of us working together.
Appreciate it. Supervisor Gregg Hart, we'll see you next time.
Thank you.